Neuromuscular dentistry is a term to describe the interrelationship of the bite with the nerves and the muscles and how this all functions effectively, and the tools that we use to try and optimise that. Neuromuscular dentistry actually is a term that was coined in the early 1960s, which seems like an awfully long time ago now, but most dentists still haven't heard about it, and which is sad. It originated in the United States, and it was actually a prosthodontist who was working at a university, but he was in the medical department, and he was there watching some exercise physiologists using this machine called an ultra-low frequency TENS machine, and the whole purpose of that was to relax the muscles and to optimise the physiology of the muscles. So he was a smart and out-of-the-box thinking dentist, and he thought to himself, well, and back in the 60s you can imagine a lot of people had dentures, and when you have lost all of your teeth, you can imagine we've lost all the ability to know where things are supposed to go. Okay, so he actually used the TENS machine to relax the muscles to what's called their resting length, and that sort of put it back where nature wanted things to be, and he was able to capture that and then build dentures at that position. And what came from that was the patients would often come back and say to him, well, I really like my dentures, but I don't have headaches anymore and I don't have neck pain anymore. And then he realised, well, you know what, we could probably use this tool now to help people who've still got their teeth, not just people who haven't got their teeth. And then it's all evolved from that. So the neuromuscular dentistry term is about the TENS machine effectively, but today it really has evolved a lot beyond that as well. We really have a physiologic approach now. There are a lot of tools that we can use. TENS is still absolutely key to that because there is no other modality that can relax the muscles physiologically to their resting length as quickly and efficiently as the TENS does. And with our EMGs and the different devices we have to measure that, we can see that objectively. So we can see these hyperactive muscles that an hour later are just lovely and relaxed. And you know that, that's all that's happened. And when they're at their resting length, we can capture that, and that's a nice neutral position for the jaw to be in. When the body is properly aligned, all your muscles should be at their resting length. If you've got a head position like this or like that, or the jaw's out to the side, or the teeth don't fit together well, or your jaw's very retruded, what happens is the muscles have to hold you there. And it's almost like if you're pushing somebody on a swing, and a little child on the swing, and then you hold them here like this, and you don't let go. You can imagine after a while those arms are going to get a bit sore. Well, all the muscles of the neck and the face, they get sore too. And that's where that pain starts to develop, because the teeth fit together back here. They don't fit together. The jaw, the muscles want you to be here, but they fit together here. And that's where it becomes a discrepancy between the two. So with neuromuscular dentistry, what we're trying to do is to find that neutral position and then build the bite at that position. So now when everything's aligned, the blood can pump back through the muscles. It's all very physiologic. It's just working with nature. There's no drugs associated with it. It's just understanding structure and understanding physiology, and then making this work with that. And it works beautifully to help people with pain.